goodness, there is certainly a lot to do to make sure your kid is ready to go back to school. School supplies, backpacks, clothes, all important, but so is your child's health. And on this Wellness Wednesday, Dr. Matthew Else from Utica Park Clinic is here to talk about what to keep in mind as we go into this new semester. Welcome back to the show today.
Thank you so much.
It's a nice day to have you. 70-something degrees outside.
It's amazing, yeah.
Loving it. So immunization's one thing that is required for all kids. It's required by state law. Can you talk about, though, the importance of those shots for kids going back to school?
Sure. So the biggest thing is it's going to vary depend on your age, but different grades will have different things like meningitis vaccines. There's going to be optional ones like the flu vaccine. So it's going to be important to talk to your doctor and see which one at which age your child's going to need to be getting. The importance of it is obviously to prevent the spread of illness. You might have seen on the news, we've been seeing some polio cases show up in New York City. So that had been eradicated. And if we continue to stay immunized, we'll continue to prevent those things from coming back.
And going from shots now to just our overall health, the pandemic, I think, has made a lot of us keep our health in mind, especially parents sending kids to school. When should parents keep their child at home when they start getting a cough or any other type of symptoms of something that could be, pretty bad, to make sure they don't bring anything home and spread it around?
Exactly. So a lot of things you want to look for is what's out of the norm for them. So if it's something like allergies, sneezing or something, that could be pretty obvious. If it's nausea, vomiting, or if they have a fever, you should really keep them home for 24 hours until after those symptoms resolve. You want to notify the school as well. And if they have any siblings, if the siblings aren't showing symptoms, they may be able to go to school, but the school should still be notified about that as well.
And right now you said you're seeing some flu cases.
Yes.
Is that common for this time of year? Because it feels like that's a little early.
It is a little early. I normally tell my patients we aim for October to get your flu shot because it'll last a good 6 months into the winter. But we are seeing some cases pop up along with a lot of COVID cases. So got to keep our eyes out, wash your hands. Yep. Yeah,
definitely. And then when kids go back to school, it's of course natural to be a little anxious, especially if you're going to a brand new school where you might not know anybody. What can parents do to kind of ease the stress and the anxiety for their kids when they are in a different and new environment?
The easiest thing is going to be telling them what they don't know, because that's the scary thing, is the unknown. So talk to them about what they can expect, what they're going to do when they get there, who they're going to see. If you can go and check it out ahead of time, you might even be able to show them their classroom or meet their teacher, show them the nurse, have some friend that they're going to go with. Make it familiar, because that's the biggest thing that will lead to anxiety is not knowing what's going to happen.
Yeah, and then I know a lot of parents with younger kids, it can be hard for them to get to bed, especially after the summer months where they've been up a little bit later. Screens are kind of a big problem where kids have more access to cell phones and iPads and all of that. What kind of boundaries can parents set with those items so that their kids are getting a good night's sleep?
Sure. You need to make sure you're really getting into a good routine ahead of the school year. A lot of people are starting tomorrow, so it might be a little late, but really start setting boundaries as far as stopping screens around 8 or 9 p.m. so that they can get a good hour to two before bed without any screens. Apple, I'm sure Android have a lot of technologies that will automatically set off apps that will close off at a certain time so that your kids are not accessing them after hours. But it's really important for them, for being able to get to sleep, to not have those screens in front of them. Sleep is important for memory, and so that they'll perform well the next day in school.
Definitely. Well, thank you so much, Dr. Else. Appreciate it. Hope you have a good, school year.
Thank you.